My name is Dr. Ngozi Chisa Nwabuoku. I'm presently the Director of Clinical Services and Training, University Health Services, Delta State University, Abraka. I want to talk about hypertension. What is hypertension? Why is it important to know about hypertension? Hypertension can also be called high blood pressure or raised blood pressure. It is a condition in which the blood pumped by the heart passes through the blood vessels, exerting high pressure on the walls of these blood vessels. As blood is carried through the blood vessels to supply the different organs of the body, this blood we are talking about is passing with a lot of pressure exerted on the walls. And so when it is persistently too high, higher than what we call normal, we say the person has hypertension or the candidate is hypertensive. So why is it important? Why do we have to know about it? What's important about this high blood pressure? We need to know about it because it is a disease of global concern. And why is it a disease of global concern? About 33% of adults aged between the ages of 30 to 79 years are having one level of hypertension or the other. And out of this 33% of the world adult population, about 2/3 of these persons dwell in the low-income and middle-income countries like our country, Nigeria. Hypertension is also known to have impacted on the life of people negatively in many ways, causing a lot of complications. In Africa, for instance, about 46%, according to World Health Organization, in 2025 September, about 46% of adults aged 25 years and above suffer hypertension. So you can see how serious it is. And worldwide, about 10 million deaths are recorded annually due to complications of hypertension. Hypertension is regarded as a silent killer. Why do we call it a silent killer? It's because most of the people suffering from hypertension are hardly aware that they are hypertensive, mainly because they don't even go to check. And some who also know that they are hypertensive are not taking their management seriously. What are the causes of hypertension? What do we need to do to avoid hypertension? And what are the signs and symptoms of hypertension? Now let's look at the sign. How do we know that somebody has hypertension? And how does the candidate know that he or she is suffering from hypertension? Many times the sufferer does not know. The person suffering from hypertension is unaware that he or she is hypertensive. But in some cases, candidates of hypertension suffer from headache, back pain, dizziness, eye ache, blood vision, chest pains, shortness of breath, nosebleeds, weakness, numbness, confusion, and so on and so forth. Virtually every organ of the body is affected in one form or the other, but these are the symptoms the sufferer will come with to say, oh, doctor, I have this headache that won't go away. I have nosebleed from time to time. In that case, the doctor now comes in to look for the signs. These are the symptoms the patient has come with. Now, what would the doctor say if a patient has hypertension. The doctor, on checking the blood pressure, will see that the blood pressure is raised above normal. The normal that we accept in the medical balance by WHO is 120 over 80 millimeters of mercury. Millimeters of mercury is the measurement, what we use to measure blood pressure. So when it is higher than 120 over 80 millimeters of mercury, we start raising eyebrow. But we will now say that somebody has hypertension when the reading is 140 over 80 millimeters of mercury or above. We will now say, oh, the person has hypertension if this reading has occurred 2 or more consecutive times. We will now say the person has hypertension. When I say 2 or more consecutive times, not at the same period. Maybe give a day or 2 interval and check again, and you see that it's consistently high. So we say that this persistent rising, this persistent increase in what we call normal is hypertension. However, in our medical management of patients, we start, being cautious if the reading is 130 over 80 or above. We'll now, take it seriously that, oh, this person is likely going to be having hypertension. What can we say are the causes of this high blood pressure? It is important to know the cause, because when you know the cause of something, you're halfway through the management. In most cases of hypertension, in a higher percentage, the cause is unknown. We can't say this is exactly the cause of this rise, this high blood pressure. We can't pin it to something, what we call primary hypertension or idiopathic hypertension. Now, it can also be secondary to something, some conditions of the body or environment. In that case, we say it is secondary hypertension, which is what we have in just a few percent of cases, say 20% or less. So, in managing hypertension, or as part of what we consider is what we look out for to say this is hypertension, person is likely to have hypertension. We look at such parameters as age. With increasing age, an individual is likely to have hypertension. The reasons are obvious. The blood vessels become tougher, they become more inelastic, and so they become more resistant to the pressure of the blood passing through it, and therefore this can lead to hypertension. Sex also is an issue. Men and women below the age of 50, there's equal chance that, but between the age of 50 and above, we have, between the age of 50 and 65, we have more men suffering hypertension, and above the age of 65, we have more women. This is evidence-based according to World Health Organization. We also notice that hypertension is more in black race than in the white race. So when somebody is black, we can, be on the lookout to checkmate hypertension. Body weight and size. When people are massive or overweight, they are more likely to suffer hypertension than people who are not. The intake of such things like alcohol, tobacco, also do increase the intake increases the risk of somebody suffering hypertension. Drug abusers, even people just buying drug over the counter without, having prescription from doctors to be sure of the way the body is before taking. Such people are likely to have also been incriminated. People whose lifestyles involve sitting in one place for a long time, who do little or no exercise, are more likely to have hypertension than very active persons. When we talk of stress, there are a lot of stress that people are passing through. So we should be careful and, have a mindset of taking things lightly and not to have ourselves under pressure most of the time. Then again, some disease conditions also predispose persons to high blood pressures. Such diseases as cardiovascular diseases like heart diseases, heart defects, diabetes mellitus, adrenal tumors, thyroid diseases, kidney diseases, and hypercholesterolemia, where the cholesterol in the body is very high. Those things predispose individuals to high blood pressure. Again, diet. High dietary salt intake is, a risk factor, as well as intake of high saturated fats. Diets that are very rich in fat, especially the low lipoproteins, those ones are, risk factors. Processed foods, because we know that most processed foods have salt in them for preservation and all that. So processed foods also predispose us to high blood pressure. Therefore, it is better to eat unprocessed foods, natural foods. Some body conditions like pregnancy also do predispose candidates to high blood pressure. Certain persons, when they are pregnant, their blood pressures go up, but when they deliver, the blood pressure comes down. So, what is the way out of this hypertension we are talking about? Like I had earlier said, a lot of complications, which include heart attack, stroke, kidney failure, heart failure, death. So almost every organ in the body is affected with persistent severe hypertension. So we have to be careful to manage the hypertension early enough and properly to reduce the incidence of these high blood pressure complications. What is the way out? Like we know, prevention is better than cure. The World Health Organization has a policy and some recommendations that people should go early, whether they are ill or not. They should go to primary healthcare centers, which are spread all over, or go to any healthcare provider and check their blood pressures. Not when the symptom arise, because by the time the person starts having the symptom, the complications are almost life-threatening. So from time to time, as a matter of routine, once in a while, maybe once in 6 months, for people who don't have issues, they should go to the clinic, have their blood pressure checked to avoid these life-threatening complications. Apart from checking the blood pressure as often as possible, persons who are already known to suffer high blood pressure should endeavor to have the equipment, this sphygmomanometer, which is the machine we use to check blood pressure. There are a lot of them, cheaper ones. Even this wristwatch that I'm wearing now is a blood pressure machine as well as a wristwatch, so that at all times they will keep their blood pressures under check. This one here is a wrist blood pressure machine. You just wear it and check your blood pressure, get the reading, and make sure your blood pressure is well under check. Take your medications and live the proper lifestyle, exercises, proper diet. With all that, one can, increase the chances of living healthy, even though the blood pressure is not the best, if it is checkmated on time. Like part of what the WHO has also recommended, that government, NGOs, bodies should ensure that there is good supply of medication, cheap and affordable, quality drugs for people who are already suffering from hypertension, to have it checkmated, to take their drugs and live healthier and productive lives. Like I said earlier, diet is important. In fact, at the very early stage of hypertension, say between 130, around 130, 80, 130, 90, usually the blood pressure can be managed based on dietary adjustments and social lifestyle adjustments too, which can help. When I say breathing, when I say exercise, simple breathing exercise can also help. Deep breath in and out is an exercise that can help oxygenation of the body and also reduce the blood pressure. So these are ways to ensure that we live healthier lives. High blood pressure or hypertension has been a menace. People having sudden deaths and people living without even knowing that they are hypertensive. Like I said earlier, about 44% of persons suffering from hypertension are not even aware. And the doctor probably will only know that these people have hypertension when they just come for other cases, other complaints, as a routine in the clinic. When any patient comes, we take the vital signs, and the blood pressure is part of what we check. So many of these hypertension cases are only discovered, incidentally when we check the blood pressure. Therefore, it is advised that any adult from the age of 18 upwards or even below should make it a routine to check the blood pressure from time to time. We also have some genetic, relationship. People whose parents are hypertensive or who have hypertension run in their family, they also are more likely to have hypertension than persons whose, genetical dispositions are not implicated. So we recommend that we in the university community and beyond should live up to the expectations that we recommend, checking our blood pressure from time to time. And for people already suffering from hypertension, take their medication, do the right things, and we look up to our God to help us even as we take the right steps. So thank you very much, and God bless you.